telling us your full name and date of birth, please?
Doris Bowman, 2nd of the 10th, 75.
Great. Okay, Doris, I'm just going to give the ladies a handover. So this is Doris, 44-year-old woman. She's just undergone a total abdominal hysterectomy and a bilateral salpingo-oophorectomy under a general anaesthetic today. She does have a history of heavy vaginal bleeding, pain and ovarian cysts. We'll just bring her up to you guys on the ward now. She tolerated the procedure without complications. She does have an abdominal incision covered with a gauze dressing with no drainage, just underneath her gown here. She's received 2 litres of Hartmann's IV fluid during the surgery, and the second litre is still running now at a 6-hourly rate. Estimated blood loss was 400 mils. She does have a Foley catheter in situ, and there's 200 mils in that urine bag there currently. She's received 3 milligrams of IV morphine just before leaving recovery, and the PCA has been connected to the patient, but not yet commenced, as Doris is she's just starting to complain of pain now. We can do the checks of the medication chart with PCA as well before I go.
Yeah.
So, medication chart.
We've got Doris Bowman, 2nd of the 10th, 75.
Yeah, lovely.
No allergies.
So she does have an antibiotic and some paracetamol regular charted, and morphine has been ceased because we're commencing now the PCA. Dansetron as required IV, PRN.
She hasn't had that yet?
Not yet.
Okay.
PCA order. IV morphine, 50 milligrams in 50 mils.
Yeah.
And the dose that it's been set for is 1 milligram per mil, and she can have that 5-minutely.
Yeah.
There's no background infusion.
Okay. So we're all connected, ready to go. We just need to talk her through it.
Lovely, thank you.
Thank you.
Thanks, Donna.
Thanks, Donna. Hey, Doris. How are you? My name's Beth.
And I'm Laura.
Hi. We're 2 of the nurses looking after you this afternoon. How are you feeling?
Yeah, I've got a bit of pain
You've got pain. Where is it?
where I had the surgery.
In your tummy?
Yeah.
Sorry, I'm going to be very gentle. That's sore.
Yeah.
Okay. All right, we'll get you some. We'll organise some pain relief for you now. We're just going to hook you up to our monitor and do some observations as well. We'll do them quite regularly for a little while because you've just had an anaesthetic and just got back from the surgery.
Okay.
So you'll feel us just doing your blood pressure now. That's going to get tight, and we'll be doing it 15-minutely.
Alright, so should I do an A to G assessment while
Yeah.
you do the obs?
So
Is
we're
that
going to
right
just
there?
check over everything, and I'm going to write down these
So
blood pressures.
We can talk
Doris.
through it together. So yeah, her airway looks is clear because she's talking to us. She's breathing. We've got rise and fall of the chest. We'll have a look at her obs shortly. She's circulation-wise, are we warm in the periphery?
Warm, yeah.
Yeah.
We've got a blood pressure yet.
Just doing your temperature in your ear.
122 over 84, that's good, and her heart rate.
Temperature's 36.8.
Her heart rate, yeah. What's the temperature, sorry?
36.8.
36.8, so she's warm, that's good. So circulation-wise, we're happy. Disability, so we've just established you've got pain in your tummy. How strong would it be on a scale from 0 to 10, Doris?
0 to 10.
Yeah, 0 being no pain at all, and 10 being unbearable, excruciating pain.
Oh, probably half, about 5.
About a 5?
Yeah.
Okay.
I might get you, so we really only want you to have a back pain score of 3 out of 10. And as Donna was mentioning on the handover, we've got this PCA set up for you here. Have you had one of those before?
No.
So it's a really cool thing because you can actually control your own pain relief and you don't have to wait for us to give it to you. So there's a machine here, it's set up with morphine, the drug that you had before, and you can press a button and give yourself a dose whenever you need it. It has a lockout of 5 minutes, so you won't be able to overdose yourself, don't worry about that. But you can just press it and it will give it to you intravenously and should work pretty quickly. Do you want to give that a go?
Or is it going to make me feel sick? Because I feel sick after the morphine I've already had.
Okay, yeah, well it can do that. So, yeah, should we
get some on Danzatron. I think she
Well,
had
we can
written up,
give you
didn't
some
she?
anti-nausea medication. I'll get that right now, Doris, and then you'll be able to go on with the PCA, because we don't want the pain to get too much worse than this now. We'll encourage you to use it. So I'm going to get an anti-nausea medication, and we'll give that to you straight away. I'll go and get that.
That's great, Beth, thanks. So in the meantime though, we've got that, you're feeling not drowsy, you're orientated, and you're able to tell us your name and date of birth.
So I'll just continue doing the A to G while you do that.
Okay, I'll get this medication.
That's disability, so I'm just going to have a look
Could
at
you check that on
patient
Dave, please?
face.
Nice, Donna. Yes. Okay. I'll look that up so you can look it up. Get that ready. I'll get this.
head stockings, that's good. Warm peripheries here. And we have got, the fluid's got a catheter. And that's draining well. There's about 200 in there, as was stated. We have fluids running and going. Lovely. Now, my sats are dropping.
How can I get that?
Just check the probe, that's good.
IV up to 8 milligrams over at least 30 seconds, preferably 3 to 5 minutes. Rapid injection may cause dizziness.
How are you going there, Doris?
Alright, we've got zero pain.
That shouldn't be off too far anymore. Now we've got, just going to connect that oxygen because our sats dropped. And the probe was not the issue. So I'll just pop that on at 3 liters now and see how we go with that. Might set you up if you're feeling nauseous. Might help a bit.
Oh, that's good.
And I've checked that flush for you at bedside. 4 milligrams against 125. Against 4 milligrams IV. Yes, and I have checked that here. It's ready. Okay, here we go, Doris. I've got this anti-nausea medication, and it should work quite quickly. Can I just check your full name and date of birth again, please?
Doris Lehman, 2nd of the 10th, 75.
Thank you. Any allergies, Doris?
No.
Okay. So you've already got this hooked up to this. Go straight into the drip. It should work quite quickly. Within a few minutes, we'll feel the difference, hopefully. If that medication doesn't help enough with the nausea, we can call the doctor and get another anti-nausea drug. But this should be good for you to just go straight on with using the morphine now and feel a bit more confident. So it's no needles. I'm going to just give this straight into the drip that's already connected. So you've got your button there, so did Nora's explained all of that to you?
Yeah.
So once that's gone in, you can probably press that button because both will work pretty quickly, okay? How strong is your pain at the moment now? Has it gone up anymore?
Yeah, it's gone up a bit.
And what is it now to a scale of 0 to 10?
Oh, about a 7.
Okay. Well, that's going through. So if you want to give it a press, you probably can. So just press it with your button like that, okay?
Yeah. Thank you.
Any more questions about the PCA, or are you happy?
No, that's okay.
Just going in now, I'll just give it a bit of a flush. So because that pain is getting a bit worse, we'll encourage you we'll remind you to push the morphine button every 5 minutes for a little while.
Okay.